Hi, my name is Cindy Dennis. This is my student ID. Today is Tuesday, September the 21st, and I'm going to be doing my speech on, my demonstration speech on removal of a PICC line. Thanks. So I have to tape that y'all are here, but there's at least 10 people in the room.
Need express written consent before you show mind and face to anyone.
And it might keep me inside. This is how I was in school.
Okay, imagine that you have a patient who's about to be discharged. Doctor said he could go home. You've just taken out his PICC line. Patient grabs his chest. He's complaining of chest pain, severe chest pain, and shortness of breath. Would you know what's wrong? Would you know what to do? According to interventional radiology literature, the incidence of air emboli in removable PICC lines, or central lines in general, is 0.13%. An air emboli is basically just an air bubble that enters the bloodstream, which can cause organ failure or even death. And even though the 0.13% is relatively low, the incidence of mortality in these patients is 30%. Now, most of you know that I worked in coronary care as a registered nurse for 18 years, and I've pulled hundreds of PICC lines and hundreds of central lines. I've never once seen an incidence of air emboli, and hopefully I never will. But today I would like to show you all how to actually remove any kind of central line safely so that we never have an incidence of an air emboli. The basic procedure is just, first of all, you need to gather all your equipment. And what you're going to need, first thing you're going to need is a doctor's order. Make sure that you have an order to take it out. You're going to need sterile gloves. You're going to need alcohol, pads, or swabs. You can use either one. You need sterile 2x2s and sterile 4x4s. You're going to need tape, Vaseline gauze, and it's a possibility that you will need a suture removal set and a sterile cup. And the only reason you'll need a sterile cup is if you're going to culture the tip. So the next thing you want to do is prepare the area. Go ahead and wash your hands and have your patient lie in bed. You'll have the patient lie flat, or slight Trendelenburg is fine. Go ahead and raise the bed up to a comfortable height for you. And then if you're working on the left side or the right side, depending, you're going to have the patient turn their head to the opposite direction. And if they can't do that, you can put a mask on the patient. Then go ahead and open all your packages, get everything all ready, and put on your sterile gloves. And then when everything's in place, you can begin removal. You're going to want to, first thing you're going to want to do is take your alcohol, you're going to take your alcohol swabs, and you're going to use those to loosen your tegaderm dressing and remove that. And then clean the area around the insertion site. And then if for some reason there are sutures, which most of the PICC lines are not really sutured in anymore, but you can use the same procedure for internal or external jugulars or subclavians, and those are usually sutured in. Then you can use your suture set and go ahead and remove your sutures. And then you want to place your sterile 4x4 over the site, right where the insertion is, and then you're going to want to grasp the hub. And then the next thing you have to do is instruct your patient to take a deep breath and hold it in. Now the main reason for this is it simulates the Valsalva maneuver, which increases intrathoracic pressure, and it decreases the risk of introduction of air into the body. So that will decrease your risk of an air embolus. So then go ahead and pull. Once you grasp this, you just go ahead and pull in the direction of the vein. If you meet any resistance at all, stop. Don't keep pulling. This can be caused by a couple things. It could be caused by, well, venous spasm. And that could be caused by either the patient has anxiety, which will cause the vein to clamp down, or if you pull too fast, it can also cause the vein to clamp down. So wait a minute and try again, and then if it comes out, great. If it doesn't, you can try putting warm compresses on. Sometimes that'll loosen it up. If it still doesn't come out, just redress it, call the doctor. It's a possibility that the patient will have to go to x-ray and have the line removed. Something's going wrong. Okay, so once your line is out, the newest literature is saying that we need to put an occlusive dressing on there. So that's what the Vaseline gauze is for. And this is brand new. This is out last week that they want you to put Vaseline gauze on. So just put a little piece of Vaseline gauze on, go ahead and put the 2x2 on, and then go ahead and put your tape on. Now, if at any time during the procedure your patient shows any signs of shortness of breath, dizziness, hypotension, anxiety, chest pain, call a rapid response right away. Put them in Trendelenburg with their head lower than their heart, and put some oxygen on them. All these could be a sign that there has been induction of an air emboli. So hopefully today you learned a little bit about air emboli, and in doing so we will help keep our patients safe. We can keep you all proficient in a skill, and everyone can manage their time a little more efficiently. And that's it. Thank you. Okay, and this is...
10 more nursing classes.
But not for you.
I'm off your diet right now.
Oh, okay. I didn't want to tempt you, that's why it was.
Well, I'm not eating it. Like, how much damage can I do?
I have to ship after the speech too. This is after. Thank you. Thank you.